again, Hayes, and welcome back to my channel. So for today's vlog, I would like to share my experience and how the routine will be when you work as a ward nurse in Australia. So regardless if you're full-time, casual, part-time, agency, you will do the same work. As per my experience, because I work as an agency nurse, but I actually asked my friend who is working as a casual in public hospital, because I work in private public hospital when I work as a ward nurse. So yeah, so it will be the same workload or the same routine. So in Australia, there are actually various shifts in the ward, so it's not just like 12-hour shifts. So it really depends on the ward, on the facility, or the hospital. So where I used to work and my friends as well, and in our hospital, we actually have 8-hour shift and 12-hour shift. Some would actually have 10-hour shift as well, but most of the time it could be 7 to 3:30 shift, 7 to 7:30 shift, and the other way around. So there's also an afternoon shift that could start at 1:30, and it's an 8-hour shift. So it really varies from ward to ward. Share my experience. So normally I just work 8-hour shift. I actually tried working 12-hour shift before, because I was asked to stay back for an 8-hour shift. You just need to go there at 7, so usually 7 o'clock is the start of the handover. So it's better to come in early at least, so that you can prepare yourself and then put your stuff away. There's a locker room mostly, and then you'll just need to go to the nurse station and grab a handover sheet. So I'm not sure if it's everywhere, but based on my experience, so there will be a printout of the handover sheet for all patients. So it will be given to you, and then you just grab a computer or an iPad if they have that, or if not, just the paper and pen, and then you'll just wait for the handover to start. And then the big handover will be done by the night charge nurse, and then they will run through all the patients. So it's good to know like all the patients' conditions. So yeah, so that's gonna be the big handover. And then afterwards, when it's all done, you will have the bedside handover. So they will actually give you their assigned patients. So for instance, you have two RNs taking care of 10 patients. So technically, it depends on what you've talked about. Like if you're gonna share, or you just like for instance, you're 1 to 5, your colleague will be 6 to 10, so, and then you can just help each other. Or sometimes there won't be anyone with you. You will just handle 5 to 6 patients, or you will have an AN around. So if you have like more than 5 patients. So yeah, it really depends on what the staffing's like. So I would say that's my experience. Yeah, so once you're done with the allocation, then you see the nurse of the patients that handle that patient from the night. So you will now do bedside handover. So the bedside handover, of course, you will need to go to the patients for a more detailed handover for each patient. So you go to patients, say hi, and the outgoing nurse will introduce you that you're just doing an handover, so that they're part of the handover as well. So whatever that's needed, you just need to document it. So once it's all done, your shift starts already. So the first thing that you need to do is actually take care of the 8 o'clock medication. So the handover might take a while. Usually you'll finish about 7:30-ish. And then, of course, if you have 5 to 6 patients, it will take a while for you to prepare all the medications. It's good if they don't have much, but based on experience, there are patients that really has a lot of medications, like more than 10. So it takes a while to prepare one. So I would suggest to start your meds, even if it's 8 o'clock, start it right after the bedside handover, and then you'll go from there. So once you're done with the meds, then you'll just need to coordinate with your partner if you have. Then you do the ADLs now. So the ADLs is the activities of daily living. So you just need to make sure that their bed will be changed. I mean the bed linen. So usually for public, they said they don't usually change it every day, but for private hospitals, it's a must to change it every day. So it really depends on the protocols, but yes, so that's part of it. And then you make sure that all the patients that are independent will have a shower, unless they don't want to, or you assist, or if patient needs assistance to have their shower, then you need to make sure that you help them as well, or someone will be there for them. Make sure in the ADL staff they've eaten as well, unless they're fasting or they have a specific diet that they need to actually have. So yeah, so that's the next thing you need to do after medications. That's ADLs, and now you need to carry out orders. So carry out orders depends on. So you just check which one you need to do first. If you need to do dressings, to do bloods, scans and referrals to any doctors, to theaters if you need to send patient to theaters. Also, if you need to check blood sugar and vital signs. So that's other things. But the OBS actually you can do it around 10 o'clock. Depends if the facility or the hospital's routine is 8 as well after meds. So usually you can do it when you do your meds. So you can do your OBS as well. Or if you have an AIN, they can do all the OBS and they can document it as well. So yes, so once you're done with the ADLs, carry out orders, so now you can have your break. So mostly you can actually finish around 10. So you can do your breaks. So you just need to inform your in charge or your partner that you're having a break. So there's a 20-minute tea break if you're an 8-hour shift. And then once you're back, you can actually do another med round. So usually the meds here are 8, 12, 2. Mostly depends on the order or the case of the patient. So you would know for sure because some hospitals they have the electronic med chart, so that's easier. Based on my experience, it's better than having a paper form of medication chart. So yep, and then you just attend the call bells as well if they code for you. So you just need to attend every time they call, just in case if something that's urgent or emergency. You can actually start doing your notes. So some notes are paperless, like it's electronic. You can just type it in the computer and then just make a draft and finalize it later. But some it's still on paper, so you just need to write down in a draft and then just finalize it later. Towards 12 o'clock is the next med, so you can prepare by 11 o'clock, 11:30, and then you carry out orders as well. Also, after that, you can actually start training trains if there's IDC. And then, of course, if you're leaving by 3, then you need to do the handover by 2, and then you can have lunch as well. So it depends on like how your day goes. So it's quite quick if you're an 8-hour shift, but of course, if you're a 12-hour shift, you just need to go by on the day. Yeah, so if there's if you're doing a 12-hour shift, you will have another break. After lunch break, you will have an afternoon tea as well. And then I think basically that's it. So once 7 o'clock night shift comes in, you'll just need to do a bedside handover to each patient that you've handled. So anything that they need to do that you haven't done or just new orders, then they just need to make sure that you hand it over to them. And before the handover, you need to make sure you finalize all your documentations. If you opt to be a ward nurse or that's your experience, so at least you'll have an idea like how it's like to work as a ward nurse in Australia. So good luck everyone. It's quite busy, I would say. Well, maybe because I'm not usually working as a bedside nurse anymore, but since I work there and I got the routine, I was like, oh, it's fine, but it's just really busy. You will not have much time to see it. You're gonna be walking around unless you've done all the ADLs and you have your break and you have good patients that are not calling you much, and that you don't need to do a lot of things like dressings, like feed them, assist them, or yeah, bloods, medication. So it really varies from patient to patient and from ward to ward. But anyhow, I wish you all the best. I feel like it's a fulfilling nursing job, and it's good to experience it once in a while when I do my agency job. So I think that's it for this vlog. Thank you so much, and good luck, everyone. And I'll see you in my next vlog. Bye. Take care.